Welcome viewers, I am Dr. Kelly Yost, psychologist and associate professor of clinical pediatrics. I work in the divisions of developmental behavioral pediatrics and in neonatology at the University of Rochester School of Medicine and Dentistry. We're here today to provide parents and caregivers and others who are interested a guide to some aspects of early child development. We have a lot to talk about, so I'll continue this topic for children 18 to 36 months in a separate webinar. Now I have to assume that viewers haven't seen that webinar, but if you have, the first several slides are the same, so you can get a cup of coffee and come on back. This webinar is one of a series sponsored by the Bureau for Early Intervention, a part of New York State's Department of Health. It's done through 3 University Centers of Excellence in Developmental Disabilities, which we call UCEDs. These centers are located here at the Strong Center for Developmental Disabilities at the University of Rochester Medical Center, at the Westchester Institute of Human Development, and at the Rose F. Kennedy Center for Developmental Disabilities in New York City. As you can see, the series is part of New York State's Systemic Improvement Plan for delivery of early intervention services to children and families across New York State. More specifically, we have been targeting family-centeredness. This is the concept of focusing on a child's family while taking into account the family's needs and resources to help support their child. We also focus on family connections to their community at large, and this is to help reduce the feeling of isolation that many families have reported. Each UCED is producing 10 webinars on a wide range of topics. All of these will be available for viewing on the BEI website. When we're done, I'd like you to become familiar with the 5 domains of development, and I will explain the 5 domains over the next few slides, and I'd like you to be able to have some sense of how early development progresses. Now I'm going to talk about the 5 domains separately, but actually they all work together. Okay, you don't need to take a lot of notes. Information I'm presenting is largely from these websites. So CDC is the Centers for Disease Control and Prevention, AAP is the American Academy of Pediatrics, and ASHA is the American Speech and Hearing Association. Here's one I do want you to write down. If you have a smartphone, I strongly encourage you to download this free app. It's available in the Apple App Store for iPhones and at Google Play for others. So let's talk about the 5 domains of development. And first we'll talk about the physical domain. Gross motor is usually described as large muscles, like how a child uses these larger muscles for the purposes of crawling, walking, running, jumping, and so on. Fine motor is more how a child uses fingers and hands, but it also includes oral motor development for feeding, swallowing, and talking. And in the sensory area, vision and hearing are essential to development, but then so are touch and smell. The cognitive domain is about how a child learns, solves problems, and thinks. It's fine, of course, to help your child out, but sometimes you can back off for a bit and see if she can figure it out herself. There's a lot of trial and error, and that's how kids learn problem solving. Next we have communication, which is receptive language like listening and understanding. Expressive language has to do with talking, but also other ways of communicating. So the other ways can include things such as sign language, gestures, pictures, and other things as well. In a way, think about how you might communicate something to someone who does not speak your language. You'd be surprised how much you can communicate with gestures. Okay, the social emotional domain. Well, this includes interest in others, how a child responds to others, a child's ability or willingness to demonstrate her own feelings, and empathy for others. It also includes how quickly and how much she gets upset, as well as the ability to calm and settle down. All of these skills are needed. Finally, we have the adaptive domain. And in my mind, adaptive is how a child puts it all together to function in the environment. It also includes the ability to cope with bodily needs, such as sleeping and eating, toileting, dressing, and safety issues. And remember, as I said it before, each of these domains can affect the others. Okay, let's talk a bit about parents. First of all, parents know their child the best. They spend the most time of anyone with their child. They're excellent observers of their child's behavior, so they watch their child and they can tell you, people like me, what the child does. Now, sometimes they interpret things a little differently than I might, so sometimes we professionals view the same behavior differently. For example, I do a lot of high-risk neonatal follow-up. These are children who had a rough early go and needed both extra and extraordinary medical care. Many times over the years, I've had parents excitedly tell me how their very young child, 6 months, 9 months, is going to be a lefty or is going to be a righty. But handedness doesn't develop till much later. Early on, we expect children to use both hands. Sometimes they will prefer one hand for a bit than the other, but again, early on, using one hand almost exclusively usually means the other one is weak. And that's a good reason to get some help. Now, parents know their own unique family culture, and that, of course, is about the family's origin and faith and cultural beliefs, but it's also about the environment in which the family lives. A single mom with 3 children in a small apartment is in a much different situation than a 2-parent, 1-child family who also has extended family living nearby to help out. Okay, so let's get back to the start. Your primary medical care provider is usually the first professional with whom you consult regularly. The question above is when your primary medical care provider should ask you at well-child visits, and this can start a conversation. So it doesn't always happen though, so then it gets up to parents. And I'm going to say, don't lose sleep, get it out. For most kids, it's not usually a problem. Most kids are fine, but some are not, and it may take a while to figure it out. Remember, you're the customer. Okay, now at well-child visits, you and your primary care provider will want to be tracking growth and development. We want to be sure kids are on target for their age, and if not, we want to start early intervention programs for delays. So PCPs, or primary care providers, can tell parents what to expect in the time until their next visit. And this goes something like, well, in the next few months we're going to be looking for Khalid to start, and so on. Often, developmental screeners can be used, and 2 common, short, and easy to complete screeners include the Ages and Stages questionnaire, and it's now in its 3rd version, and it takes about 10 to 15 minutes to complete. Another one is the MCHAT, the Modified Checklist for Autism in Toddlers, and it's a revised edition now. It's a short 18-question screen for autism. It's generally done at 18 months and at 2 years, again, to screen for autism. So there has been a debate, or there used to be a debate, about is it nature or nurture? Is it what a child inherently has inside, or is it how they are raised? Well, actually, the answer is both, because different children have different capacities for learning and development. However, enriching the child's environment plays an enormous role as well. For example, by the time they get to kindergarten, we know that middle-class children are typically exposed to far more language than less advantaged families. Okay, I said earlier that all the domains work together. So let's think about what a child needs to do to get potty trained. He needs to have the sensation, that's sensory, that his bladder is filling up and that he can control it, and then he needs to recognize what that feeling means when really that's a cognitive function. Then we have to remember that we have a special place for that right there. And then next, of course, he has to get there, hopefully in time, and that involves motor and or communication. And when he finally gets there, he has to relax his control to let it go. And that's physical, sensory, and cognitive. And my goodness, this is complicated. So, okay, let's see some kids. Here we are at 2 months, and we're looking at some social, emotional, and adaptive development. The child, when upset, may be able to briefly calm herself, often by bringing hands and mouth to the mouth and sucking on her hands. Here is an example of physical development. And by the way, the world looks a whole lot different when you can look around. See how she's pushing up? Here is some more social, emotional development. When your baby reacts to you, it's hard not to engage him. Okay, we're going to go through what most kids do at certain ages. And so for now, it's 2 months. And in physical development, they can hold their head up and they begin to push up when they're lying on their tummy. And they're beginning to make smoother movements with arms and legs. But I'm going to say this is a good time to mention hearing screenings. Usually this is done in the newborn nursery. Ask your primary care provider if it was done. We want to watch closely to be sure your child's hearing is okay. Commonly at this age, you will see some facial reactions such as eyes widening, eyes shifting or blinking, and quieting in response to sound. If you don't, be sure to ask for a hearing screening. In the cognitive area, kids are really starting to pay attention to faces. They're beginning to follow things with their eyes and recognize people from a distance. They can also act bored if things don't change. In the social emotional area, they're beginning to smile at people, and it's just wonderful when they do. Again, the child can briefly calm himself, and they try to look at you. In the communication area, they're making some noises. They're cooing and making gurgling sounds, and they respond to sounds, especially voices. In the adaptive area, now hopefully your child is feeding either from breast or bottle. And again, we put this in lots of different areas, but can briefly calm himself. So what can you do for your 2-month-old? Well, cuddle, talk, play all the time when you're feeding and dressing and bathing. Help your baby learn to calm himself, and it's okay for her to suck on her fingers. You can begin to help your baby get into routine, such as sleeping at night more than in the day. Try to get into regular schedules. Get in tune with what your baby likes and dislikes, and it can help you feel a lot more comfortable and confident in your ability as a parent. Act excited, smile when your baby makes sounds. Copy your baby's sounds, but also use clear language. Pay attention to your baby's different cries so you learn to know what he wants. Some fun things you can do: play peekaboo and help your baby play peekaboo too. Put a baby-safe mirror in your baby's crib so she can look at herself. Look at pictures with your baby. Talk about them. You can put your baby on his tummy when he's awake and put toys near him. And encourage him to reach out. Encourage your baby to lift his head by holding the toys up at eye level. You make him work a little bit. You can hold a toy or a rattle above your child's head and encourage her to reach. Hold your baby upright with feet on the floor and sing or talk to your baby. Talk, read, and sing to your baby. So throughout this webinar, we're also going to talk about acting early. And act early by talking to your child's doctor or nurse. If the child's missing milestones, if your child doesn't respond to loud sounds, again, that may be worth a hearing screening. If your child doesn't watch things as they move, if your child doesn't smile at people and doesn't bring hands up to her mouth, and if your child can't hold her head up when pushing up on the tummy, that's another thing we're looking at for motor development. If your child doesn't coo or make sounds, or does not push down with legs when you are holding your child and feet are placed on a hard surface. And also if your child seems to have trouble moving one or both eyes in all directions. Now let's move on to 4 months. Okay, at 4 months, we're looking to have your child start moving or following moving things with his eyes from side to side. So here the stuffed animal starts here and it moves over to here. Notice how he pushes up further now and he has better head control than he did before. Here's another example of improved head control. Holding head up all by himself. Now baby is reaching out for things. She may hold on to things you put in her hand, at least for a while. Kids are naturally curious, and if you give them the opportunity, they'll explore. At 4 months, baby's now letting you know if he's happy or sad. This one looks like he's having a good time, but at this point they're really letting you know about sad. At 4 months, baby may be able to roll from tummy to back. And this is physical development. Tummy to back happens first, and it looks here like she's thinking about it. Yep, and starting her move. And ta-da, she did it. It's time to cheer her on. It's okay to let her get a little frustrated trying. Keep encouraging her. If you hold her upright, she'll push down on her legs when her feet hit a solid surface. And you will see your medical provider doing this test in a well baby visit. Keep giving her opportunities. Now they're pushing up on their elbows and they make such cute faces when they do. And now you can see how she's getting better at reaching. Kids smile, especially at people. And this is a very important social emotional step. We call it a social smile. Kids with autism don't do this very well, so we keep a good eye out for it. However, just because your child isn't doing this yet, it does not mean your child has autism. Here is a really good example of some physical development and coordination. You can see her coordinating eyes and hands. Now, sure, it makes it easier to reach for and to get things. And kids with some motor issues may have trouble doing this, but so will kids whose vision isn't all there either. And babies like to watch faces. They're just hardwired to do that, and especially faces of the people that they know. Okay, let's review what most 4-month-olds do. They can hold their head steady unsupported, so you don't have to have your hand in back. They push down on their legs when their feet are on a hard surface. They may be able to roll over from tummy to back, but a lot of kids don't at this point. They can hold a toy and shake it, and they swing at dangling toys. They will bring their hands or anything else they have in their hands to their mouth, and when they're lying on their stomach, they may start pushing up on their elbows. In the cognitive area, she lets you know if she's happy or sad. She responds to affection, reaches out for toys with one hand, uses eyes and hands together, follows things with eyes from side to side, watches faces closely, recognizes familiar people. In the social emotional area, and you can see that there's really quite a bit of overlap from what I said in the cognitive area, your child smiles spontaneously, especially at people, and they like to play with people, and they might cry when the playing stops. They can copy some movements and facial expressions like smiling or frowning. In the communication area, they're beginning to babble. And they babble with expression and maybe starting to copy some sounds that he hears. And they can cry in different ways to show if they are hungry, if they hurt, or if they're tired. And that's where you get to know your baby. What do these cries mean? In the adaptive area, hopefully your child's sleeping more at night. Hopefully your child is feeding well from bottle or breast, and they will often put their hands on the bottle, though not really holding it. They may cry out in different ways, as I said before, and that helps you to determine whether they're hungry, hurt, or just tired. So here's some things you can do for your 4-month-old. Hold and talk to your baby. Smile. Be cheerful. Set some steady routines to the degree that you can do that. Pay close attention to what your baby likes and what your baby doesn't like, and this will help you to learn how best to meet his needs. Copy your baby's sounds. Act excited and smile when your baby does make sounds. You can have some quiet playtimes when you read or sing to your baby. Give your baby some age-appropriate toys to play with, like rattles and colorful pictures. Give your child some safe opportunities to reach for toys and explore his surroundings. Put toys near your baby so he can reach for them or kick her feet. You can put toys and rattles in baby's hands and help him hold them. Play games like peekaboo. Act early. So, as always, if your child doesn't seem to be meeting milestones, if your child doesn't watch things as they move, if your child doesn't smile at people, if your child can't hold her head steady or coo and make sounds, if your child isn't bringing hands to mouth and things to her mouth, if your child doesn't push down with legs when her feet are placed on a hard surface, or has trouble moving one or both eyes in all directions. Okay, so now let's move to 6 months. At 6 months, your child begins to pass things from one hand to the other. We say she transfers from hand to hand, and while we look at this as a motor skill, that skill will be used in adaptive behavior. At 6 months, more and more, bringing things to her mouth. Before this, lots of kids get their hands in their mouths, but now she can bring things there, including things you don't want and she shouldn't have, so baby-proof your home. Your child is strong enough now to sit without support, and your child's balance keeps improving. I would still suggest putting a pillow behind him just in case he does lose his balance and falls backwards. Curiosity. At 6 months, they're getting very curious about things, and they try to get things that are a little out of their reach. That's okay. Let them reach for it, and that can be a motivator. Curiosity helps drive a child to be mobile. Things that used to be out of reach may not be any longer. At 6 months, your child knows some familiar faces and also begins to know if someone is a stranger. So this is a nice social emotional step. We have a big smile for family, but not so much for people she doesn't recognize. Playing with others, especially parents. Look how these two are really connecting with each other. It's so much fun. It's what we hope for all families, but it doesn't always come true. I remember seeing a child who was quite delayed and not responding much at all. I explained that to her family. The mom, of course, was very upset, but some of her tears were relief. She thought her son didn't respond to her because he didn't like her, and that was not true at all. Here we have another 6-month-old. He's getting his first solids and learning how to do it. His 3-year-old sister is helping too, and you can see him use some of those motor skills to get the food. Notice how mom demonstrates and explains things to the 3-year-old. The sister will appear again in the 36-month video, and here both baby and toddler are learning adaptive behavior. And by the way, this boy loves to eat.
Okay, here we go, Lucas. Ready? Let me try the first. Let's stick it down. Ready? Let's try it. Daddy's gonna be so mad that we did this without him. Well, he needs to learn that he can swallow it. What do you think, Lucas?
Can I eat?
Oh, good boy.
Can I eat for myself?
All right. Yeah, okay, ready? Here's a little bit. There you go now. Good job, Lucas. Now let me, yeah, but I gotta get the stuff that's falling out of his mouth. He doesn't know how to eat yet, so he's just learning.
Well, baby, I can eat all the meals.
That's right. Ready? Okay, Lucas, hold on. Ready? Yummy, Lucas.
Can I feed him all by myself?
Yeah, ready? Hold on, let me get some on there. Okay, ready? Lucas. Yep. Lucas, look. Yay! Good job. That's way too much, sweetie. Ready?
All by myself.
Okay. Oh! Too far in. Just a little bit in his mouth. Just the little part, front part. Good job, Lucas.
Here we are, what most children can do by age 6 months. They can roll over in both directions, so front to back to front, and they're beginning to sit without support. When they're standing, they can support their weight on their legs, and they might bounce a bit. They can't balance yet though. On hands and knees, they may be rocking back and forth. In the cognitive area, they're looking around at things that are nearby, bringing things to their mouth. They're curious about things and they try to get things that are out of reach. And they begin to pass things from one hand to the other. In the social emotional area, they know familiar faces and they begin to know if someone is a stranger. They like to respond, they like to play with others, especially their parents, and they respond to other people's emotions and often seem happy. They love to look at themselves in a mirror. In the communication area, the child is now really responding to sounds by making sounds. The child can string some vowels together when babbling, like that. They like to take turns with their parent when making sounds, and they're starting to respond to their own name. They make sounds, they show joy, and when they're not happy, and you may start to hear some consonant sounds, with ma, ba, ba, things like that. In the adaptive area, as you saw in the video, starting to bring food up to her mouth, can help to hold his bottle, but isn't really doing it by himself. Cooperates more with tasks like dressing and bathing, and tending to sleep better at night. I sure hope so for you. And they make sounds to show if they're happy or unhappy. Okay, here's what you can do for your 6-month-old. I'm going to emphasize this over and over. Baby-proof your home. Get in the habit now. It's not moving too much yet, but it's going to happen, and it may happen fast. Play on the floor with your baby. Try to do it every day. And learn to read your baby's moods. If he's upset, take a break, comfort your baby. If he's happy, keep doing it. Show your baby how to comfort herself when she's upset. She may suck on her fingers, and that can help her to self-soothe. Use reciprocal play. When he smiles, you smile. And when he makes sounds, you copy them. Repeat your child's sounds. Say simple words like, your child says ba, and you can say, oh, bottle or book, depending, of course, on what you have there. As always, read books to your child every day. Praise her when she babbles and kind of reads too. When your baby's looking at something, point to it. Talk about it. We're going to talk about getting lots and lots of language in there. When your child drops a toy, pick it up and give it back. And this game helps him to learn cause and effect. I have found as your child is getting older, they love dropping things and they love having you pick them up. So this is another instance of, for a kid, it's a whole lot of fun. For the adult, not so much. So colorful picture books, point out new things to your baby, name them, again, more and more vocabulary. And you can even, when you're looking at a magazine, things like that, show pictures and you can name things. You can hold your baby up while she sits or support her with pillows. Let her look around, give her the toys to look at while she balances. And you can put your baby on his tummy or her back and put toys just out of reach. Encourage him to roll over and reach for those toys. Again, act early. If your child's missing some of these milestones, if your child doesn't try to get things that are out of reach, I don't mean succeeds all the time, but if they don't try, if they're really not affectionate for caregivers, if they don't respond to sounds, if they're having trouble getting things up to their mouth, really, if your child isn't making some vowel sounds, if your child doesn't roll over in either direction, if your child doesn't laugh or make squealing sounds, or seems really stiff with tight muscles. On the other hand, if your child seems like she is very floppy like a rag doll, these are really good reasons to get in touch with your doctor or your nurse. Okay, here we are at 9 months. Okay, there's so many things happening here. She can sit by herself, so she can use her hands for other things and watch what you do. Copying sounds technically falls into the communication domain, but copying both sounds and gestures is a cognitive function, imitation. See how this little peanut is watching what's going on. At 9 months, your child is starting to look for things that she may see you hide. This is another cognitive skill, and we call it object permanence. Really, here it's just the early beginnings of it. And it means that something still exists even when you can't see it. So here's mom, and starting to hide. Now see how the motor skills come in too? Watch this. I can bend over while holding on to things and reach in and get it. At 9 months, your child is beginning to pick up things like serial O's between their thumb and index finger, and we call that a pincer grasp. And before this, kids tend to grab at things whole-handedly. Pincer grasp takes good fine motor skills combined with vision. At 9 months, your child may be pulling to stand or at least trying to get there. These kids just want to move. So you see here he gets himself into position. He pushes up on his left leg while balancing and pulling his right leg forward. And ta-da, he made it. And he's a happy kid. Once they have this down, they love to do it. And while they're standing and holding on, the world looks a whole lot different from up there, and gives you a chance to do other things. It also gives your child a chance to get into trouble, so baby-proof your house. At 9 months, kids are moving things from one hand to the other, but much more smoothly. So remember at 6 months when we talked about transferring objects from hand to hand? Here we are again. We're going to start at the right hand, and now we get to the middle, and look how much smoother it is. And we made it to the left hand. Good job. See this little one point? It's a bit clumsy, but it will get better. This is a wonderful combination of motor, cognitive, communication, and social emotional skills. Reading to your child is one of the best things you can do. Television just doesn't respond in the same way. And here, she's really learning to focus. Okay, 9 months, what most children do. Physically, they're standing and holding on. So they can't stand independently, although I've certainly seen some kids who can, but typically no. They can get themselves into a sitting position, and they can definitely sit without support here. They're pulling to stand, or at least trying, and they're crawling, which is kind of belly on the floor, and kind of pulling with arms and pushing with legs. In the cognitive area, kids will start to watch the path of something as it falls. It doesn't just disappear out of their life. They like to look for things they see you hide, and peekaboo gets to be a great game here. They're still putting things in their mouth, and again, baby-proof, and they can move things smoothly from one hand to the other, and they're getting good at picking up things with their thumb and index finger. Pincer grasp, small object between the pad and thumb and finger, and that's good also for turning pages. In the social emotional area, you might start getting afraid of strangers and maybe clingy with familiar adults. Your child definitely is developing favorite toys. In the communication area, they're starting to understand no, although sometimes they get mixed up with tone of voice. They make a lot of different sounds like ma, 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 ba, ba, ba. So these are consonant vowel combinations. They're beginning to copy sounds and some gestures that other people do, and they're using their fingers to kind of point at things close up. In the adaptive area, they're finger feeding. They'll bring stuff up to their mouth, so you gotta watch it. And they're beginning to certainly moving things towards things that she may want. So what you can do for your 9-month-old. Have I mentioned baby proofing? Pay attention to the way your child reacts to new situations and people, and try to continue to do things that make your baby happy and comfortable. When she moves around some more, stay close so she knows you're near, and continue with routines. They're especially important now. Kids really seem to do best with routines. You can play games with, oh, my turn, oh, your turn. You can say what your baby is feeling. Oh, you're sad. Let's see if we can make you feel better. Lots and lots of talking. Describe what your baby is looking at, and you can expand things. You could say ball. You could also say red ball. Talk to your baby about what she wants when she points at something. Copy your baby's sounds. Copy your baby's words. You can ask for behaviors that you want, so you're not always telling your child no. So instead of saying don't stand, you can say, oh, time to sit. You can teach cause and effect by rolling balls back and forth, pushing toy cars and trucks, and putting blocks in and out of a container. Kids really start to like doing that. Play peekaboo, read and talk. That's going to be in every single age range. Give your baby lots of room to move and explore, but again, a safe area. And put your baby close to things so she can pull up onto them safely. Again, if your child is missing milestones, talk to your doctor or nurse. If your child isn't able to bear weight on legs with support, if your child isn't sitting now, if your child isn't babbling like mama, baba, dada, if your child doesn't seem to play any games with back and forth play, if your child isn't responding to his name at all, if your child doesn't seem to recognize familiar people and doesn't start to look where you point, and if your child is not transferring toys from one hand to the other, talk to your doctor or your nurse. Okay, let's see what 12-month-old kids can do. Well, they get quite good at copying little gestures. They have favorite things like stuffed animals, and they enjoy having them, and they can really help soothe. That's mostly a good thing, as her favorite animal can help her feel more secure. It can also help calm her when you go to new places because she still has something that's familiar. They can help with sleeping and soothing. Sometimes there's a downside though, like when you can't find the bear or if you happen to leave it at Grandma's house. Okay, finding things pretty easily, or hidden things. So remember at 9 months how your child could start to search for things he saw you hide? Same thing here, he's just gotten good at it. See, looking, and there. So kids get better at finding things that have moved. These are skills from the cognitive domain, but again, you see he needs eyes and hands to do them. Here's a wonderful series of motor skills. Your child is moving now. Have you baby-proofed your home yet? See, starting to get into a sitting position, getting closer, and there, all the way up. Here, your child may hand you things when Well, in this case, a book, if he wants to hear a story. This is a wonderful combination of cognitive communication, motor, and social emotional skills. Adaptive behavior too. Your child is communicating what he wants. He wants the book, of course, but also wants to be with you. Okay, kids may stand alone at 1 year. He's a little unsteady. See how mom is ready to catch him? But he's getting there. At 1 year, they love playing peekaboo and patty cake, and these are wonderful social emotional games, and they are so much fun. See, there we go, and peekaboo. Your child may love to keep going even after you get tired of it. My personal experience is that I can only play so many patty cake games before I'm ready to move on. At 1 year, your child is putting her arm or leg out to help with dressing. And this is an example of adaptive skills getting better. Your child has learned much of the routine, and it doesn't always mean that he likes it. And it takes more time to have your child help with things, but do it when you can. It's how he learns. And here we have a child who's poking, kind of pointing to things with an index finger. Remember at 9 months how she pointed to things using most of her hand? Now she's getting that pointer out. Okay, at 12 months, what do most kids do? Well, in the physical area, they are getting to a sitting position without help. They're pulling to stand and walking, holding on to furniture, which we call cruising. And they may take a few steps without holding on, but gotta watch out. And they might stand alone too. In the cognitive area, they like to explore things in different ways, like shaking and banging and throwing. Each of those things can get tiresome for an adult, but for a kid it's lots of fun. They can easily find things after watching them get hidden by others. And they look at the right picture or thing when it's named, so they're really recognizing some words now. They're copying some gestures. They certainly bang two things together. And they like to put things in a container and take things out of a container. I like to call that fill and dump. They let things go without any help, and again they're poking things with their index finger. In the social emotional area, your child is getting shy or nervous with strangers, and they can cry when mom or dad leave. They certainly have their favorite things and people, and they can get pretty fearful in some situations. They like to hand you things just to indicate things that they want. They may be repeating sounds or actions to get attention, and again, peekaboo, patty cake, great games, wonderful back and forth games. In the communication area, they respond to simple spoken requests. They're learning language, and they use simple gestures like shaking their head no or waving bye-bye. You may start to see no happen a lot, but certainly bye-bye. They make sounds with changes in tone, so things are starting to sound a little bit more like speech. And they're probably going to say mama and dada and things like uh-oh, and may try to say words that you say. In the adaptive area, they're really starting to use things correctly. Drinking from a cup, brushing their hair, following simple directions like pick up your toy or the toy, and putting their arms or legs out to help with dressing. Okay, things you can do. You can do lots for your 12-month-old. Give your child time to get to know a new caregiver. Bring a favorite toy, a stuffed animal, or a blanket to help comfort your child. Sometimes that gets called a transitional object, but I think it's just having something for a kid that your kid likes. In response to unwanted behaviors, do say no, so that's fine, but don't yell or spank or give long explanations. A timeout for 30 seconds to 1 minute might help to redirect your child, and that's really what timeout is. It's to stop the behavior and get them out of the situation. So it is not really designed to be punishment. Give your child lots of hugs, kisses, and praise for good behavior. Remember, I will say this in the other one, in the 18 to 36 month webinar. We want to catch your child doing it right. Catch your child being good. So spend lots more time encouraging wanted behaviors than in punishing unwanted behaviors. We usually, just a rule of thumb, 4 times as much encouragement for things you want her to do as for redirection for unwanted behaviors. At 12 months, you can talk to your child about what you're doing. Mommy's washing your hands with a washcloth. Mommy is cooking. Mommy is, fill in the blank. Read with your child every day and have your child turn the pages. We're looking at your child being able to do that now. Take turns labeling pictures with your child. Build on what your child says or tries to say, or what he points to. If he points to a truck and says "t" or truck, say, yeah, that's a big blue truck. That's how language gets expanded. Give your child crayons and paper and let your child draw freely, but again, I'll say in a safe place. Show your child how to draw lines up and down and across the page, and praise your child when she tries to copy them. Playing with blocks and shape sorters and other toys that encourage your child to use her hands are also great toys, and they don't cost that much. You can hide small toys and other things and have your child find them. Ask your child to label body parts or things you see while driving in your car. Sing songs with actions like the itsy bitsy spider and the wheels on the bus. Help your child do the actions with you. Give your child pots and pans or a small musical instrument like drums or cymbals. Encourage your child to make noise. I appreciate that gets kind of old after a while. Provide lots of safe places for your toddler to explore. Now, your child may be moving, so toddler-proof your home. Lock away cleaning products if you can. Put child locks in your kitchen, underneath your sink. Safety gates, keeping them away from stairs. Locked doors to the outside in the basement. And also, give your child push toys like a wagon or a kiddie push car. Act early. Again, if your child is missing milestones, if your child doesn't crawl or can't stand when supported, if your child doesn't search for things that she sees you hide or isn't saying single words like mama or dada, if your child doesn't learn gestures like waving, with bye-bye or shaking head, or doesn't point to things, as always, if your child loses skills he once had, talk to your doctor or your nurse. Okay, so for whatever reason you are concerned about your child's development and you want to know what to do, what can you do? First, you talk to your child's primary medical care provider. You can ask about early intervention. Your primary care provider can make an early intervention referral for an evaluation if he or she thinks that's appropriate. Your child will get a no-cost evaluation in the areas of concern. If your child qualifies, he becomes eligible for no-cost services targeting the area or areas of need. You'll be assigned a service coordinator to help you through everything and to develop a plan with you. Your child will also get support services in the areas of need. Common ones include special education, physical or occupational therapy, and/or speech and language therapy. but some kids might need input from a vision therapist or a teacher of the hearing impaired. So while these providers actually work with your child, they can also help you learn how best to support your child when the therapist is not there. Remember, you're your child's primary teacher. I mentioned earlier that the IFACT project has also worked to help counties put in place ways for families to feel more connected and less isolated from others and their communities. Each county decided what might work best for their own county. You can ask your service coordinator or any of the providers about resources your county may have for connecting to other families with kids in EI or other resources that might be available. For example, some counties and parents have developed Facebook pages or other ways for families to connect and let them know what's happening in the county for families and kids. Early intervention is coordinated mostly through your county Department of Health. That's not always the case, but generally that's true. You can Google your county's Department of Health. At the state level, you can get a lot of information from BEI, the Bureau for Early Intervention. BEI is hosting this entire webinar series, and they have many other resources available as well. I put the website URL up here, but honestly, you can just Google New York State Early Intervention. Okay, you can call your school district, and I mean, this is cheating a bit. Your school district does not provide early intervention services, but I have had a number of families who seem to have trouble making connections, and they actually got some information from their school district. It's not the fastest way to go, though. Now, if your child is 2.5 years or older, she will transition to preschool at age 3. This varies a bit on the time of year because many districts don't offer summer preschool programming, or they do, but not until your child has shown she'll regress over the summer if she doesn't get those services. However, call your district. They need to know your child might also be coming to them as a preschooler, and you need information. Now, as I said before, if your child is 3 years old or just a few months away, definitely call your school district. Okay, we are reaching the end here. So for more information, you can look at these websites. They have lots of good information there from CDC and American Academy of Pediatrics. I'll remind you again that if you have a smartphone, download these free apps. It's either in the Apple App Store or Google Play. I want to thank the University Center for Excellence in Developmental Disabilities at the University of Rochester School of Medicine and my colleagues here who have helped with this webinar. And special thanks to the New York State Department of Health and Bureau of Early Intervention for their support with funding, organization, and helpful comments. As I mentioned at the start, I will be doing another webinar on child development focusing on kids 18 to 36 months. It's on the BEI website and is available for viewing. So thanks for watching. And now get down there and play.